everyone, I'm Charlotte Kilpatrick reporting for Vaccine Nation from the World Vaccine Congress in Washington. I'm delighted that today we're joined by Dr. Kumiko Lippold of BARDA. Thank you for joining us. To kick us off, would you kindly introduce yourself? Sorry for interrupting you.
No. Thank you. I'm happy to be here. My name is Kumiko Lippold. I am a health scientist at BARDA, and as a health scientist, I wear many different hats. One of those roles is I am the acting branch chief of the Alliance Office in the Division of Research, Innovation, and Ventures, otherwise known as DRIVE, in BARDA, the Biomedical Advanced Research and Development Authority of the Department of Health and Human Services. That's a mouthful. I know it's a mouthful. But in addition, one of the other hats that I wear is that I am the program manager of the Patch Forward Prize, which I believe we're going to talk about today. I'm very excited to talk about it.
Absolutely. So I was just about to ask you, you've recently announced the launch of the Patch Forward Prize. Could you tell us a bit more about this?
Yeah, so the Patch Forward Prize, I think to take a step back a little bit and just talk about what BARDA generally does and how we like to partner. Our approach is to advancing our health security and supporting health security initiatives within the United States is to establish really unique public-private partnerships. That is at the helm of BARDA's model. So we closely partner with industry to develop new technologies and new approaches for vaccines and therapeutics and diagnostics that can really help enhance our preparedness and response posture. So the prize competition, the Patch Forward Prize, is one example of an innovative effort that we have within BARDA to help enhance our preparedness and response. So the Patch Forward Prize in general is focused on advancing the development of a microneedle-based RNA vaccine by supporting early preclinical development all the way through phase 1. So ultimately, our goal with this effort is to see a microneedle-based vaccine either for COVID-19, seasonal flu, or pandemic influenza, which has become quite timely with the H5N1 emergence, and see that be formulated onto a microneedle patch that can ultimately be commercialized and reach the market where people can use it. And I would also be remiss to not let you know that this prize challenge is actually just one component of a much broader BARDA and HHS effort under Project NextGen that we have launched in collaboration with the National NIAID. And under that effort, we're focused really on improving access to highly effective medical countermeasures, such as vaccines and therapeutics, and just increasing access for the general public.
Fantastic. Thanks so much for that summary. It sounds like a really exciting initiative. So can you tell us a bit more about the needs that you're aiming to meet with this prize? What are you encouraging to come forward?
Yeah, so there's a couple different goals that we have as part of this prize. The first one, sort of technically speaking, is that we see microneedle patches as having a lot of promise as a tool in our preparedness and response toolbox in our ability to respond to pandemics. So microneedle patches are not necessarily the sole solution from our perspective. They are one component of a holistic, well-rounded response effort. And microneedle patches in particular present a lot of benefits over the conventional needle and syringe because they may be able to increase thermostability of vaccines. They reduce our reliance on cold chain, as we've seen with the COVID-19 pandemic. Having to transport vaccines in minus 80 freezers is very logistically challenging, especially in resource-limited geographies. And then in general, we also want to help support the development of both early stage developers and advanced developers. We've seen that with all of these companies that are operating in the RNA vaccine and microneedle space, that they're at various stages of development. So in designing this prize challenge, we were very intentional with trying to make sure that we could balance both interests of all companies so that we could, in general, help raise the field and increase the technical maturity of these approaches altogether. So in terms of the things that we're trying to reach and we're trying to solicit as part of this, we're trying to help facilitate the development of new impactful partnerships, the things that are at the heart of what BARDA aims to do, create really impactful partnerships, so that we can help mature these microneedle patches from this early stage of development all the way to phase 1 clinical trial, and then ultimately long-term onto the market where people can actually use them and access them.
Fantastic, thank you for that. So what might a successful application or the ideal ambition look like for someone who was hoping to put themselves forward for this?
Yeah, that's a challenging question. I think with a prize challenge, the real strength of a prize challenge is that it allows us to put out a really ambitious goal and be a little agnostic to the solution. What's really unique about this approach, BARDA has typically operated with contracts, and most people who work with BARDA are very familiar with contracts. And a prize challenge is sort of a unique approach that we've started learning about and experimenting with in terms of our program design. So with this, we are putting out the goal of formulate an RNA vaccine onto a patch. How you get there, as long as you meet our eligibility criteria, we are rather agnostic to. We want to see as many different innovative approaches as we possibly can. We think, in general, based on the eligibility criteria and what we're looking for in the concept stage, which you can find out more about on the website, we're looking for approaches on paper that are technically sound, have, if available, some preclinical evidence to support the approach. We're very interested in making sure that this approach has a high likelihood of actually being able to translate into a phase 1 clinical trial. But all of that said, with we have a 3-stage approach with the prize. It's really focused, as I mentioned, on trying to raise the field. We have the concept stage, which is a white paper. We have the preclinical stage, which is IND-enabling preclinical studies. And then we have our phase 1 clinical stage. So in the very first stage, the preclinical stage, we are really focused on ideas on paper, and we recognize that companies that participate might not have the resources or have a really robust suite of data that they can share. So we wanted to provide them an opportunity where they could receive some funding to carry them through into the next phase. So success it really depends on the company, and we don't want to define success because success might come in a package that we didn't anticipate.
Fantastic. It's great to hear how open-minded and receptive this prize is to hopefully a whole range of competitive applications. So that's really exciting. My final question is, obviously you have shared this with us at the Congress. What else are you hoping to achieve at your time here, and what are you hoping to gain from it?
Yeah, so we are really grateful for the opportunity to meet with as many different companies as possible as part of the Congress. It's been just a really incredible opportunity to have these sort of sidebar conversations with companies that have come up to us and say, we've heard about the prize, I want to learn more. And that's what we're here for. BARDA is here to learn from companies, to meet you where you're at, to hear about the state of your technology, where you think it fits into the overall BARDA strategy. So we're really looking forward to meeting with more companies and hearing about your technologies and approaches. And we always try to keep our door open to make sure that we're here and we're listening.
Lovely. Well, I'm sure many people will be coming through that door.
Yeah.
So thank you very much for your time, and enjoy the rest of your Congress.
Thank you.